Remember that of the 5 steps of evidence-based practice, the first is to pose an answerable question. The second is to search for the evidence. The third is to critically appraise the evidence for its validity and relevance. The fourth is to make a decision by integrating the evidence with clinical experience and patient-client values. The fifth is to evaluate performance after acting on the evidence. We are focusing on how to ask a question. Type 1 questions, those that cannot be scientifically answered, and Type 2 questions, general questions that are also called background questions, were covered in the previous lecture. Right now we're talking about Type 3 questions. Type 3 questions are also scientifically answerable, but they are specific questions dealing with a specific patient or population of patients or a specific condition of that patient. This type of question is also called a foreground question. For example, for a premature infant born at 33 weeks, is the use of a topically applied lanolin emollient more effective in assisting the infant to retain body heat than the use of a topically applied petroleum emollient? This is a question that is related to treatment. In children, does chronic otitis media, as compared to children without chronic otitis media, increase the risk of poor school performance in the elementary grades? This is a question related to risk. In mothers who consume 20 ounces or more of peanut butter during pregnancy, as compared to those who consume less than 20 ounces, what is the subsequent rate of severe peanut allergies in their children by age 5? This question is related to prevalence. In women, is the CA-125 blood test as accurate diagnosing ovarian cancer as pelvic ultrasonography? This is a question related to diagnostics. Each of these questions has 4 parts: the patient, person, or population, the intervention, the comparison, the outcome, and sometimes there is a 5th component of clinical questions, that is time. So in this question, a premature infant born at 33 weeks is the patient or population. The topically applied lanolin is the intervention. The topically applied petroleum is the comparison intervention. And the outcome is retention of body heat. In this question, children are the population. The intervention is the consumption of 20 ounces or more of peanut butter during pregnancy. The comparison is the consumption of less than 20 ounces of peanut butter during pregnancy. The outcome is the rate of severe peanut allergies in those children. And this question has a time component, that the allergies are diagnosed by age 5. Here is our diagnosis question. Take a few seconds and see if you can figure out what the P, patient or population is, the I, intervention, the C, comparison, and the O, outcome are. For this question, women are the population. The intervention is the CA-125 blood test. The comparison is the pelvic ultrasonography. And the outcome is accurate diagnosis of ovarian cancer. A well-built clinical question identifies the patient, problem, or population, the intervention, the comparison, the outcome, and sometimes time. This is called the PICO, which is sometimes pronounced PICO, method for teaching clinical questions. Or when the question includes a time frame, it is called PICO/T or PICO/T. In this lecture, we have focused on deconstructing PICO questions. In the next lecture, we will look at how to create PICO questions.